One of the biggest dilemmas men face after the diagnosis of prostate cancer is how to choose between the fact that there are different treatment modalities that are available, and the decision making can be quite complex. Certainly, international and Australian studies have suggested that the outcomes in terms of the cancer control are comparable between surgery and radiation. So, Jeremy, do you want to talk us through some of the factors that might help to guide the treatment decision making?
Yeah, I think that it's important to realise that while the outcomes in terms of the control of the cancer are the same, that surgery and radiation are very different in other factors, and patients need to be helped to understand that and given guidance to work out what's important to them and what can be provided for them to help them make the decision, because it's very important that the patient participates as much as possible in coming to a conclusion about the best form of treatment. And so the sort of things that we need to take into effect, take into account the specific health problems of that particular patient and their symptoms and what is important to them. We need to also sometimes look at cost. If patients have to travel for long distances to have radiation treatment, for example, it might be much more appropriate for them to have surgery. And finally, another thing that comes into it is local expertise. So in some regions in Australia, it may be very difficult to have radiation treatment, for example, whereas there might be a local hospital where you might be treated with surgery. And so these are sort of things we take into account, but we have, there are specific things that we can talk about perhaps after that.
So can you highlight which patients may not be ideal candidates for radiation therapy for prostate cancer?
Yeah, sure. So if men have a large amount of lower urinary tract side effect symptoms, we often are better treated with surgery, because the surgery not only addresses their prostate cancer problem, but it can address their symptoms. So we would tend to shy away from men who are distressed by obstructive or urgency symptoms. Similarly, men who have a very large prostate can have a lot of symptoms after radiation treatment, and the surgery can fix their large prostate problem and their cancer problem. So they're the sort of patients that we might guide towards surgeons. If we're thinking about brachytherapy, we're particularly interested in the urinary flow. So seed brachytherapy, for example, is a great treatment for prostate cancer, but in the weeks after treatment, the obstructive problems can be troublesome, and if men start off with obstructive prostates to begin with, then we're going to make that a lot worse. So we're trying to avoid those sort of men. The radiation treatment can irritate the bowel, and so that's a particular problem if men already have a bowel pathology such as inflammatory bowel disease. So we'd try and steer those men away from having radiation treatment. Clearly, men who live a long way away from radiation centres in regional Australia would be best treated perhaps with a local surgical treatment if they are able to do that. There is a small risk of secondary cancer. So if you have radiation treatment, we know that in the long run, a very small fraction of those will have a higher rates of bladder or bowel cancer than would be expected in the patients who haven't had radiation treatment. So that might be something to take into account, particularly with young men. And men who have a issue with worrying about bowel function are probably better guided towards surgery, because radiation more than surgery will affect their bowel function. So what about surgery? What sort of men would you avoid with surgery if you could, Sean?
Yeah, so similarly, there are particular factors that may guide the selection of men for radiation in preference to surgery, so particularly those who are older or have comorbidities that might make an anaesthetic or surgery riskier. Those who want to continue to work through their treatment, because certainly the procedure of having the surgery and then recovering from it will impact on most men's ability to work, whereas many can continue to work working around the timing of their radiation therapy. If there's a high concern about sexual function, then brachytherapy seems to be the best choice for those men. If there's a high concern regarding incontinence, then they're perhaps better choosing a radiation modality because that certainly is a lower risk. And certainly under certain circumstances, very extensive local disease that cannot be surgically resected could be covered with an appropriate radiation field. So those are probably the main criteria on which we would recommend against surgery for men.
Right. But the important thing, I think, is that we both surgeons and radiation oncologists talk to guys about the pros and the cons of each and allow them to make an informed choice about the treatment that they have.
I think information is key, and I think particularly now having a good unbiased information, for example, through sources such as the Prostate Cancer Foundation, having the support from the prostate cancer nurses has been very helpful in this decision-making process for most people.